to that medullary cavity is where we find osteoblasts and osteoclasts, which are bone cells involved in bone formation, bone remodeling. Blasts build bone, clasts break it down. So we have this layer that's going to be involved in bone formation. In the inside of the cavity, we have what we call an endosteum, and the endosteum also has osteoclasts and osteoclasts. So we're forming bone on either side. They're always going to be on the free surfaces, the bone cells. Now once, say, osteoblasts put down all that matrix to make bone, and they kind of, I would say, paint themselves in a corner, those bone cells become, and you already know the name, where they're sitting in their lacuna. What are the bone cells that are already sitting in their lacuna?
Osteocytes.
Osteocytes. So the osteocytes are going to be found inside because they pretty much surrounded themselves with the calcium and the phosphate and all that. So we have the periosteum, which is support blood vessels. Some of the ligaments or tendons may be attached to the periosteum. The diaphysis gives kind of support to the bone. Okay, covered articular cartilage, which is where you have on either end, that's where you form the joints. So you form joints on the proximal and distal epiphyses. Is there any one I didn't cover? She's just doing a label. So can I look at yours? Can I
Please.
Okay. So we can label these a little bit later. It says, which component of long bone is being described? Contains hematopoietic tissue. That would be the red bone marrow. Okay?
Which is in the spongy bone?
Which is found in the spongy bone of the proximal epiphysis.
Of the proximal epiphysis. So how can you tell which is proximal? And did you tell me already?
You will know. When you learn all the bones, you'll
Okay, you'll be
eventually
able to
know which
see.
is the proximal.
Okay.
So you will know at some point when you look at the long bones which is proximal, which is distal. Because I'll do it as we go along. Say, get this bone, okay, this is the proximal end, and then we'll move on. Okay, and this is the proximal here. Okay, that's a humerus, what that one is. Composed of hyaline cartilage is being replaced during endochondral ossification. That is called the epiphyseal plate. This says here epiphyseal line. The epiphyseal line is when ossification has ended. So epiphyseal plate is going to be involved in long bone growth. So epiphyseal plate is hyaline cartilage that eventually slowly being replaced by bone. When long bone growth is ended, you have this epiphyseal line. And actually, if I take an X-ray of your hands, I will see the epiphyseal line. If you're young, real young, and your bone growth hasn't finished, I'll see space in there because hyaline cartilage is not going to be picked up by an X-ray. Just the bone is. The connective tissue that provides an attachment for muscles, the outer, and contains osteoblasts. That was the periosteum. Okay, it's number 3. So that's going to be found on the outer surface of the bone. Okay, it contains yellow marrow. That was your medullary cavity found within the diaphysis. The gliding surface for articulations, is that where they do it in the blue, is the articular cartilage. That does wear down as you get older. That's why you start hearing and when those little joints are crack. It's not really it's crack. The articular cartilage.
Articulation means where it
Joint.
goes together.
Mhm.
Okay.
Joining together. Something that articulates is a joint. Portion of the bones that articulate with another bone. Those are the epiphyses. So the long bones, the epiphyses are what's forming the joints. Rigidity to the bone, the shaft is called the diaphysis. That's the shaft of the bone. Okay? So this is the long bones. Okay? So you notice the blood vessel coming into the bone. Bone is very, very vascular. So if you break a bone, it repairs itself fairly easy because it's very vascular. Okay? Also, there's a problem though. If you break a bone, you always have to be worried about emboli. Okay? Because you could have portions of the bone come off, go into the bloodstream, or even you get fat emboli because the yellow marrow can go off into your bloodstream and lug something up. So that's always a issue that people have to worry about is if with fractures is the risk of having an embolus as a result of it. Okay, and that has happened with very young people dying as a result of just having a break in their bone. Okay? Now, don't freak out, you know, they're all gonna die. You always have to be careful of it. All right, so here's the same thing. Okay, so I'll let you look at that in case you needed to label something on your bone. And at a little point, I'll bring in our little cut-up bone to show you it's not gonna be the most perfect one. This one is actually a femur. What you have here
Is the compact bone specifically in the diaphysis?
No, it's on the outsides.
It's on the.
It's always on the it's the outside.
Oh, I see. Okay. It's on the outside, but not the outside, like not the actual.
It's pretty much the
Is it
whole outer
whole
core
outer
shell of the bone is compact bone.
It's compact bone. Okay.
Yeah, the whole outer core. So if I cut through here though, in an adult, in this, you'll have the compact bone and you're just gonna see the yellow bone marrow. In the epiphyses, you'll see some of the spongy bone in the epiphyses, in the interior, right in here. They didn't cut through that so you can't see it. Okay?
What are the?
So I have a question.
Yeah.
I had one case where a girl was trying to get to grow taller or something,
Mm-hmm.
and they I guess they broke her bones. They fractured the bones in two places. Where would they do that?
Probably anywhere along here. Anywhere along there. Because again, you break a bone,
So it
what it's
just
going to do,
grows.
it's going to repair itself and make more bone. So what they're doing is they're giving more room for it to kind of fill in. That's what they're doing. They're supporting it. So, but because bone will, and actually bone, if you stress a bone, one of the things is, and this is why you should be active, is when you keep stress gravity, not swimming. Stress a bone, it forms bone. Your bones will be more dense. So if you become inactive, and especially as you get older, your chances of osteoporosis go up. But weight bearing is very good to keep bone nice and thick and sturdy. And so, and also when we start looking at the different bones, and you're going to see things sticking out, like like here, different things that stick out. Those are places where you have muscles, or I should say tendons attached, because you're putting tension on the bone. It's kind of giving itself a little bit more strength by producing that bone. So that's where we have attachments to certain things, is where you ever see these little, what we call bone markings. But bone markings could be articulation spots, what you see like right here, but other places is because it's attachment for either tendons or ligaments. So it's put stress on the bone. So putting stress on bone helps bone to keep their size. Now, once you hit about 25, pretty much long bone growth should be done. But you can still maintain the thickness of bone as an adult. But the long bone, you're not going to get any taller, but you can also maintain the density of bone. So that's why you need to kind of stay active. It has to be weight bearing. That's why astronauts, they lose bone being up in space because of lack of gravity. So there's a lot of problems that result as them being up in, especially some of those astronauts up there for a long period of time, is they come down, there's a lot of issues that result from it. So they do lose some. They do have some of them doing certain things to try to maintain bone density, but they do lose bone density because of lack of gravity when they're up there, okay? All right, so what I'm gonna do, here's a flat bone, so here's a flat bone. So I call it the sandwich. Compact bone with some spongy bone in between, so I call it the sandwich for the flat bones, okay? It's a little bit different. Now the long bones are more for leverage movement. Flat bones are more for protection. Okay, so there you see those are going to be more like seeing the skull, the sternum. You also have in your pelvic bones the ilium, nice flat bone. This is where they go and drill sometimes if they're doing bone marrow transplants. They go for the ilium because it's nice big flat bone. So they go in there. They're not going to go into your sternum. That would not be good. I don't think I want to be drilling in my sternum, but they'll go into your hip. All right, so we're going to do axial skeleton. So skull, the vertebra, the rib cage, and some associated bones. That's what we're going to start with. The appendicular skeleton will be the pectoral girdle and the upper limbs, and the pelvic girdle and the lower limb. So we're gonna do the axial skeleton first. The skull, there's actually a lot of those bones or various associated markings that you already know. That limits how much more studying you have to do, because if you already know the lobes of the brain, you know some of the names of the skull bones. Okay, so we're gonna do skull. Now the auditory ossicles you actually already know, right? Those are considered part of the axial skeleton, or associated ones. So what are the names of the ossicles?
Malleus,
Malleus, incus, and stapes. You got 3 in each ear. Okay? They're bones. Yeah. They're the smallest bones in your body. No, those are bones. And then remember, they're synovial joints. They move. They're pretty movable. Okay? The hyoid bone is the one I showed you. That's going to be associated with it. And then we're going to look at the other ones. So these are the numbers. So you have to, if I tell you how many cranial bones do I have, how many facial bones, you're going to have to tell me numbers. So the skull bones, we're going to look at these. There's 8 of them. So some of them we got 2 of each. Facial bones, we got 14. So total in the skull we have 22. So if I ask you how many skull bones do we have, you're going to say 22. If I say how many cranial bones?
8.
8. Facial bones, 14. Now these are the associated ones. You got the 6 auditory ossicles in that 1 hyoid bone. Okay. So these we're going to start with the skull first. Okay. So if you look, before we look at the skull, you kind of have to know names of sutures, things that kind of tie up the bones. Now these are examples of synarthrotic joints. They're not movable. So if you look at your skull, you should see this particular suture that kind of runs right down. If I did a cut, I would be and separate you, and by cutting like this, what kind of cut would I be doing? Sagittal. So you already know this. This is a sagittal suture. You're going to find that separating the 2 bones on either side, which you actually already know, as you know what lobes of the brain it protects. Parietal. So these are the 2 parietal bones, and it's protecting the parietal lobes of the brain. So you have the sagittal suture, which kind of separates the 2, or not separates, it connects the 2 parietal bones. This one in the front, you should see a suture that goes all the way across right here. And if I put something on my head, like a crown, that's how I would put it on my head. So a word for crown, coronal. Yeah, corona. Corona means crown. So this is the coronal suture. It separates, or joins, I should keep saying separated, it's actually joins, forms a joint between the parietal bones and this bone, which protects the lobe of the brain found right here. Frontal. So you already knew that one. So here is the frontal bone. That is the coronal suture. Now over here, see on this side, and it's going to be found on the other side too. This is, what's the bone that's going to be protecting the lobe of the brain found right here? Temporal. So here's a temporal bone. The temporal bone is also found on the other side. This is the squamous suture. I don't know where they came up with the name, because squamous means flat. Okay, but I don't know why. There's got to be a reason why they came up. But the squamous suture you see on either side that separates the parietal lobe from the temporal lobe, or bone.
Wait, so do you want to say separates or it joins?
It joins.
Okay.
I keep wanting to say separate, but
it does sort of separate. I get what you're saying.
It's our landmark that kind of divides the 2, but it is a joint. So it joins. It joins.
Okay.
It joins. I don't know why I keep wanting to say separates, but find it between.
So landmark, it kind of separates, but the function is that it joins.
Yes, it joins them too. Now in the back, you don't see it real well here, but you can see part of it. If you look at the back of the skull, this one's the hardest one. Lambdoidal, L-A-M-B, lambdoidal suture. So, yeah, like, lambdoidal. And this bone, you already know. Occipital. So some of the bones you already know. So we have sutures. And there's also other ones, but they're the only ones that you have to name. So anytime you see the little things, you see them associated with the face. The sutures are what's joining the bones that you find in bones of your skull. The only place where you won't find a sutural bone, and it's the only bone of the skull that is freely movable, is the mandible. That arm, that's not, there's no suture there, that's a synovial joint. So the mandible, you won't find a suture associated with the mandible, with the other parts of the skull. Now the fontanelles, I'm just going to show you the fontanelles. I never ask anything about the fontanelles. The soft spots where the babies get, we always say, be careful, don't press in there. Now there's a reason why babies have soft spots. Well, no, there's a reason why they had to have them in the first place. No, it's like, why don't they just come out all fully formed? They gotta get out through that birth canal.
That's why their heads are always stupid.
Yeah, when they come out, some are like, and they're gonna push in there. So, but allow, because it makes it easier for them to come out through the birth canal. So it gives a little bit of movement. But no, some kids are kind of, their heads are like all, which, but it allows that movement.
It
But-
goes back though. They look like corn heads and then it goes back.
Yeah, well.
Usually.
Usually.
It's supposed to.
They're supposed to. But they do, all those soft spots eventually close up, and they close up at different times. So here's showing you kind of areas that you'd find the soft spots. Most what people know about this one, you're like, oh, because you could actually, you have to feel it, you can see it.
Yeah.
And the little kids, you're like, hey, yeah, it's a little soft spot. That's where you gotta be careful though. Because it's soft, it's not hard, so you gotta be careful that you don't drop anything on that poor kid's head because it's not gonna protect its brain as much. But eventually it all gets ossified and closes up. So these are your different fontanelles that you have. And they close up at different stages in the kid's life when they close up.
Well,
Now-
I met a little girl who had a mastoidectomy, like what you were talking about.
Oh,
The
she had an ear infection?
She was little. She was like a baby, the newborn, and she got an infection. They didn't know it was wrong, and they took her into the hospital, and
So
it
they
was
moved
so
part of
bad
it?
they